Hey, great question about vasculitis. What is vasculitis? Sometimes we say leukocytoclastic vasculitis, or LCV. So leukocytes are white blood cells that in an autoimmune way can attack the blood vessels, the small little capillaries in our dermis. And so they attack it so much that they sort of die and they have all this leukocytoclasia on pathology, which is basically white blood cell or leukocyte guts that they spill all over those little capillaries. So why does LCV or vasculitis occur? Oh my goodness. Half the time it's idiopathic. We don't know why we get these little palpable purpura, red dots all over our lower legs, but half the time we can figure it out due to a new medication that started. It can be due to an infection that they've had. It can be due to oral contraceptive pills that they start. It can be due to pregnancy. It can be due to a myriad of different things that is new in their life that you can figure out. Sometimes where I practice in the Central Valley of California, we see it, for example, with coccidiomycosis or valley fever. So depending on where you are, you might want to check some blood work like a quantiferon, a cocci titer, hepatitis panel, CBC, CMP, make sure nothing's going on. One of the most common infections that causes it is strep throat. So maybe add an ASO titer on your labs. We often biopsy these patients and put them to prove the LCV and put them on prednisone. If you see the LCV palpable purpura extending not just on their legs, but up their rear end, even onto their trunk, you should be doing a DIF biopsy as well of a purpuric macule to make sure it is not Henoch-Schönlein purpura, which is IgA vasculitis that we really need to pay attention to their kidneys because they can have proteinuria or hematuria for many months. We need to check that urinalysis to make sure that resolves. Feel free to comment down below whatever you want me to try to cover next.